kick it off.
Okay, go ahead.
So, hey, here we are again, the Ben and Gary Show. We know dentistry, and as you know, we are answering questions from our audience. And the most recent one that came through was one that referenced sports injuries, and particularly talking about if a tooth gets knocked out or a portion of the tooth gets knocked off, or even the tooth gets knocked out of place. What do you do? And I think maybe we can consider how we're going to talk about that one and break it down into from least severe to most severe.
That makes sense.
And I think the least severe, Gary, I could think of a particular situation that we were just talking about here, that my nephew, who is 11 years old, knocked out his tooth, quote unquote. And I got the message that his tooth got knocked out, and I'm thinking it's the whole tooth. And in reference to what really happened, it was actually part of the tooth. So only a portion of his central front tooth got knocked off. And fortunately, they were able to keep the piece.
Right.
And once he finally got to me later on that day, the piece, believe it or not, actually fit right back into the same position, almost with nothing gone, almost like a puzzle piece.
Right.
And so that was probably the best case scenario, because it started the heck out of everybody, including my nephew. But actually, as it went on, he seemed to be the most calm individual out of all of this.
Yep.
And so we were able to use that exact same piece and fit back into the tooth like a puzzle piece, and we were able to bond that small piece back into position. Now that, as you know, kind of worked well because it didn't involve the nerve. It was just sort of a corner of the tooth, and significant enough, obviously, where you would notice that there's something wrong with your tooth and that something's gone. But at such a young age, I worry about the fact that this is just going to be an ongoing problem. It's going to be a chronic problem for the rest of his life. It's never going to really go away. So we'll have to do something more definitive for him later on. But it was fortunate enough to be able to get the right color match, because it was the same piece, and just sort of bond that little piece back into place and kind of keep our fingers crossed that maybe watch out for the nerve for symptoms if later on that this tooth became more and more sensitive. So I know we're going to do a follow-up. So the point being is, if it's something, a portion of the tooth that you had the tooth, that can be bonded back, or a section of it, if you don't have that piece left, can be bonded with some tooth-colored bond. I guess going forward, we want to make sure that the nerve of this tooth is going to be healthy. And probably the time to be able to evaluate that and know more about the health of it is that you're going to have to wait some time, because initially it's going to be a bit hypersensitive to any test that we're going to do. And that could give what we consider to be a false positive, meaning that we kind of overdiagnosed it and kind of jumped in to do something, or need to do, say, a root canal. That would have been too soon, because of whatever symptoms he was, or this particular case, my nephew, would have been giving us a little better assessment later on down the line. So in the meantime, of course, you monitor if the sensitivity is going to increase pretty significantly in a short period of time. Then that may spell that there's a greater problem here. But for the most part, what's occurred is that it's been kind of uneventful, and that there have been a little bit of sensitivity, but that's not necessarily something that we're ready to jump in and start doing anything with just yet.
Given that situation, the outcome was pretty good.
It's pretty good. He got his own tooth almost completely whole back again. But now I guess the key on that one is it's not going to last forever, unfortunately. And so we'll deal with that when the time comes. And at such a young age, usually you try to be as conservative as possible, and not have to move towards something like a veneer, porcelain veneer, a crown on top of that tooth, unless we really had to. Because as we know, nothing lasts forever. So if you at 11 years old get a veneer, a porcelain veneer, you're going to have a few of those later on down the line, because at that young age, they're probably not going to take care of it like you would as an adult. And so maybe by the time, let's see, they're in their early 20s, they probably have to get it redone if they're lucky that it lasts that long. And as you can envision, if they live a long life, that there's going to be quite a few revisions that are going to be necessary. So what happens when, say something like more of the tooth breaks and the tooth isn't actually out of your mouth, not the whole tooth, the root's still there, and you can even see a portion of, say, the tooth left, but now it's into the little bit further, some things. Maybe the nerve is involved, and actually you're going to see a bleeding sort of little spot in the center of the tooth that's was a healthy tooth that's now probably not going to be so healthy. And so I think now we're talking about not just simply just bonding back into place, which we
Right.
probably still would do, but there's going to be probably another step that's going to be necessary.
Right. Yeah. So, what do you think? A root canal, huh?
It's probably a good chance that it's going to need a root canal, and
Yeah,
at that point in time, maybe sooner might be
Yeah.
better when that occurs.
Yeah.
Okay.
Yeah. Especially if it's exposed, and who knows how long it's uncovered.
Right.
Right,
And,
so-
and a lot of these can actually go along and be uneventful, but eventually that the tooth might discolor, and that usually is a sign that the tooth has died, and the nerve, I should say, has died,
Right.
and that it no longer has any sensation to hot or cold, or if you have a cavity, you're never going to feel it.
Right.
That sensation, that nerve, is what gives you that feedback that there's a problem. And when a root canal is done, we've talked about this on previous shows, that the nerve is actually removed, and that space is then filled back with filling material, and that takes away the chance of infection, but it unfortunately kind of renders that tooth sort of almost no sensation to anything like hot, cold, or a cavity, like if
Right.
you're going to eat something sweet.
Right.
And you'll still be able to feel the tooth that actually wiggle and in your mouth, but that's a different story altogether.
Yeah.
So I think that if you're fortunate to have a break and to be a little bit more, you're probably going to want to get to your dentist right away. And we've heard people talking about going to the emergency room. All you're going to do is have a lesson in frustration, because you're going to be waiting. Because as traumatic as that might seem to us,
Yeah.
or to the individual, to an emergency room, they're dealing with life and death.
Right.
And a broken tooth, even in a tooth that has been not completely knocked out, which we're going to get to, is probably not going to be on their priority list for you.
Right.
So you're going to be kind of miserable. So the idea is get to your dentist, or if you have an oral surgeon that you have used to be able to say remove your wisdom teeth. That would also be an individual that you might want to get to.
Yeah.
On an emergency basis, but certainly get to your dentist, and the emergency room is probably not the right place for you.
Right.
Now, if you had further trauma and it's beyond just a tooth,
Right.
obviously emergency room is something you might want to be consider. But if it's just a tooth, I think you're going to be waiting a long time,
Right.
and the emergency room is not the best place.
Right.
On occasion, though, and when situations are even more severe, a tooth can be displaced, maybe not
Right.
broken, but out of alignment.
Yeah.
What would you recommend somebody do in that situation?
Well, so usually, and not to pick on basketball players, but elbows are flying, and and oftentimes when they don't wear mouth guards, guess
Ugh.
what happens? Boom,
Yeah.
you get hit with an elbow, and the tooth is usually pushed back into the oral cavity a bit. Sometimes a lot, sometimes not so much, but and it can be multiple or just a single tooth. But if it's pushed back, then again you want to see the dentist, and oftentimes we can pretty much push it back, and once you're numb, you can push it back into place, and then you have to stabilize it somehow.
Right.
So
Yeah.
oftentimes you can use a wire and
Wire in the front, almost like some braces
Bond
in the
it
front,
up,
or a
yeah.
wire on the back, depending on how
Yeah.
you wanted to do it. But it's just there to be able to brace it a little bit better.
right,
And it's almost like setting a broken limb in a cast.
right,
You want to hold the pieces together as much as possible.
right.
Now,
How long do you keep it in?
yeah,
Split there.
I would even step back for a second here before, even if you are brave enough as a lay person and you see your child with in that situation where they may have moved the tooth backwards and out of alignment, and you can tell it's not in alignment.
Yeah.
If you can brave through it, it's probably a good idea to be able to try and move that back into its alignment
Original place, yeah.
right then and there. And it may hurt when you do that here, but if the patient or the individual can stand it,
Yeah.
you're going to want to try to move them back into position as quickly as possible, and then get to the dentist. And but if you can't do that, then
Yeah.
clearly you're getting numb. And by the time you get to the dentist
Yeah.
and wait a little bit, then I'm sure the pain is going to probably start to come. But when it initially happens, a lot of times the shock and awe of all of that kind of, you almost don't really feel the same level of pain.
Yeah.
So that might be the best time to be able to
That's
move
true.
them back.
Yeah.
But to your point about having to brace those teeth if they're out of alignment, the amount of period of time that is recommended, and the research says, is going to be about 4 weeks.
Yeah.
You don't want to let it go back too much beyond that, because that tooth can actually be further damaged, and we call it being ankylosed.
Right.
And ankylosed is something where that tooth is really kind of almost fused with the bone in your jaw, and it is going to become immobile completely and never be able to be even moved from that position.
Right.
And usually that's going to lead to a cascade of events where that tooth is going to be lost, and of course that's what we're trying to avoid.
Right.
I think the worst scenario is that the actual tooth, it's completely root and what you see in your mouth in terms of what you bite with comes out in one piece.
Right.
In that case, you definitely want to make sure that you can save that tooth. If it, say, for instance, falls on the ground, you want to make sure that you don't pick it up by the root of the tooth. You want to only pick it up by what is the part you see, the enamel, the top part of the tooth, and not touch the root part.
Right.
I know that you can certainly try to rinse it off, and the idea is probably not with tap water because it may be all you have, but if you have some saline, and you might be in, like, say, at school in the nurse's station here, the saline I'm sure that they would have on hand. And then if try to get that tooth back into position. If you're kind of wary about that here, then the faster you can get to your dentist to be able to reposition that tooth into the socket, the better.
Right. And to your point, you don't want to rub the root because you're trying to preserve the periodontal ligaments, which are
the cells on the outside.
Right.
Don't want to be disrupted or crushed or damaged. Right. That's why we don't want to touch that.
Right.
So if there's debris on it here, you want to get that off. You don't want to stick that right back inside someone's jaw. That will probably lead to a whole another set of events. Right. But the need to be able to just keep it clean and not touch those cells and disrupt them is critical.
Right. So the ideal time that you want to see your dentist to get the tooth back into the socket is within an hour. The quicker, the better. The less time that goes by.
How are they going to transport it, though? What's like the best way? Is it a baggie? Is it a cup? I mean, what is it?
I mean,
paper towel?
Most people don't carry this ring solution with them, right?
Yeah.
So
the drugstores have this solution that's specifically designed to be able to place the tooth in so that it's kept at the right pH and the right the conditions so that it would still be healthy and allowed to be able to still be a live tooth then when you put it back in again.
But short of that, just put it back in your mouth underneath your tongue and transport it that way.
That's right.
That would be the best way.
Yeah, and you've even talked about using a milk solution. That can be something in a pinch if you have that. But probably either the solution from the drugstore. Most people don't have that in their back pocket. But the other way is right in your mouth. Get to your dentist. Get in there within the hour. It sounds like that might be a challenge, but that's what we're shooting for. And so ultimately, we'd like to be able to put that back into position, stabilize it or splint it, as we often will say, whether with a wire or somehow bond it to the adjacent teeth temporarily, and so that it's more secure in position.
Right.
And leave it alone, baby it, and probably be on some soft foods and not want to bite with your front teeth for a little while.
Right.
So that's probably our set of recommendations based on what the problem might be. If it's just a portion of the tooth, greater portion of the tooth, it out of alignment, or even completely out, there's ways for us to be able to save that tooth and hopefully have it around for the rest of your life. Hope these recommendations are helpful for you, and I hope that this situation never happens to you, but if it does, you have some ideas of what to do.
Right.
Take care. We'll see you next time on the show. Ben and Gary Show, we know dentistry.
Bye-bye.
Bye-bye.